I welcome you to the ninth session of the Healthy Heart, Healthy Life Pune series about the health of our heart. We are continuing to discuss angina differential diagnosis, means conditions which look like angina but which are actually not angina. Last time we discussed about musculoskeletal pain. This time we are going to discuss the next topic. I am Dr. Nilkant Karandikar. Please note down my WhatsApp number 98220 I do cardiac consultations and non-invasive cardiac procedures like echocardiography, stress test, interventional cardiac procedures like angiography, angioplasty, pacemakers. My credentials include being given the post of Honorary Professor Emeritus in Cardiology at the BJ Government Medical College and Sassoon Hospitals. And I am also the first gold medalist of the Bombay University, now Mumbai University, at the DM Cardiology examination, super specialty examination. My attachments are mentioned in this slide. We have discussed earlier that angina is caused by reduced blood flow to the heart, primarily due to number one, atherosclerotic coronary artery disease, which is the most common cause, and there is a plaque buildup in the coronary arteries. As is shown here in this diagram, the yellow plaque has built up in the coronary artery and is blocking the flow of blood, forward flow of blood uh, in the heart, in the vessel supplying the heart. The next is coronary artery spasm. Sudden tightening of the coronary arteries can occur without atherosclerotic coronary artery disease. And in this picture, it is shown that this coronary artery has undergone a sort of constriction or contraction, and this is called coronary artery spasm. This is much lesser cause of chest pain causing angina. And the least common cause probably is the coronary microvascular disease, damage to the tiny arteries of the heart. As you can see here, these are the epicardial big coronary arteries, and the very small branches, the capillaries at this level, if there is a disease, then it can cause also angina. It is called coronary microvascular disease. This was just a revision of what we have discussed earlier. Now, this is also a revision diagram where we know that where all the angina occurs, which areas of the chest, neck, and arms, and inner side of the arms, etc. Now, talking about conditions which mimic angina or which look like angina but are not actually angina, let us start with this very important session. What is this lady doing? Holding her abdomen and she's grimacing with pain. So obviously she's having pain in that area of her stomach called abdomen also. So let us come to gastrointestinal or abdominal causes of pain which can mimic angina or which can look like angina. This area shown in the circle of lower chest and upper abdomen can be a very confusing area both for the patient and for the doctor as to making a correct diagnosis of whether the pain is due to heart pain or angina, whether it is muscular pain, like we discussed last time, or whether it is because of whether the pain is because of abdominal causes like acidity, etc. This is the chest, this is the abdomen that is shown in this picture. So this is again a very common cause of pain, which can be called as chest pain also because it comes to the lower part of the chest. Now, this young lady is having pain in this area, and her stomach has been shown here and flames coming out of it, indicating that the basic cause is in this area in her stomach. Normally, you know, after we eat food, it comes down through this esophagus, or the food pipe comes into the stomach. The food mixes with the stomach acid, and as the stomach contracts and relaxes, it gets mixed up. But this mixture cannot enter the upper pipe called esophagus or the food pipe. Lower end of esophagus muscle that closes to prevent the acid reflux. This is what a healthy stomach and esophagus would act like. There will be no acid reflux. But if there is a reflux of this acidic content of the stomach into the lower esophagus, then what happens is there is heartburn, and let us look at that. Heartburn or acid reflux, in medical terms, it is called gastroesophageal reflux disease, or GERD is the short form. This heartburn, the pain is in the upper abdomen or lower chest. It worsens on lying down, because when you lie down, the food and the acid move up into the lower end of the esophagus or the food pipe. Doesn't spread to other parts of the body. This pain can last for several hours if not treated. The pain is relieved with antacids. The best thing to do is take a liquid antacid. Many are available. Some of them are very good. When you take 2-3 spoons of this antacid, the pain gets relieved. And this kind of pain may be accompanied by bloating and altered taste. So very, very common cause of pain, heartburn or acid reflux, which may mimic angina. Let us go on to the next cause. Peptic ulcer, very, very common word, almost known to everybody. What does peptic ulcer means? Peptic ulcer means ulcer either in the stomach, as it is shown here, or it can be in the tube which comes out from the stomach called duodenum. This is duodenal ulcer. This is gastric ulcer. What are the causes? Non-steroidal anti-inflammatory drugs. We take pain relievers. So many are there, aspirin and so many other drugs. Or there is an organism called Helicobacter pylori. Infection of this organism can also lead to peptic ulcer. What are the complaints? Again, upper abdominal pain, nausea, bloating, lack of appetite, weight loss, and heartburn. So, somewhat similar to what we saw in the first instant, GERD, gastroesophageal reflux disease. Peptic ulcer symptoms appear somewhat similar. Upper abdominal pain, nausea, bloating, lack of appetite, weight loss, and heartburn. Peptic ulcer disease, as it is called, there is epigastric burning, pain that can radiate to the chest. So you feel sometimes whether it is angina. Then the relation to the meals helps distinguish from angina. Now see, if you take something like cold milk or some very, very bland food like, say, custard or something like that, this pain, the acid in the stomach gets diluted, neutralized, and the pain may be relieved. But if you take highly spicy food, something, lot of chilies in it, then this pain can increase. But the relation to food helps in diagnosing peptic ulcer pain. Let us move on to the next cause, gallstones or biliary colic, right upper quadrant or epigastric pain radiating to chest or shoulder, often postprandial, means after meals, may be mistaken for cardiac pain. Here in this diagram, this is the liver and this is the gallbladder, which contains secretion of the liver called bile. And in this gallbladder, there can be gallstones which can form here, and it can cause right lower quadrant pain or right-sided abdominal or stomach area pain, which can move up to the chest also. Now, if these gallstones are free floating in the gallbladder, usually there is no big problem. But if one of them goes and blocks the bile duct, then there is severe pain, and this can become a little bit of an emergency also, and this gallbladder may have to be removed with an operation or with percutaneous procedures. Now, we were taught when we were undergraduate students, fat, fair female of 40. Now, this girl shown here is not fat, neither she looks 40, but a fat, fair female of 40 is a typical patient having gallstones. So, the third cause of gastrointestinal pain mimicking angina that we have seen just now is gallstones. Not serious if they are free floating in the gallbladder, but if they block the outlet of the gallbladder, they can create problem, severe pain also. Now, let us come to the last cause, esophageal spasm. Intense chest pain due to abnormal esophageal contractions. Pain may be exertional and relieved by nitrate. Nitrate is a drug which is used to relieve angina. And this kind of pain is also relieved by nitrate group of drugs, and therefore this can be confused for angina. Here is the esophagus, which is the food pipe which takes food from the mouth, down the throat, up to the stomach. This is the lower esophageal sphincter, which normally does not allow the acidic contents of the stomach to move up here. And this is the stomach down here. So this is the esophagus, normal. Now, if diffuse esophageal spasm is a rare motility disorder of the esophagus, you can see here that this esophagus has been highlighted to show that it has undergone a spasm or a contraction. It is due to uncoordinated simultaneous contractions of the musculature of the esophagus. This is not a very common disorder, but it can perfectly look like angina. It can be relieved with the drugs which relieve angina, and therefore consultation of a doctor or a cardiologist is necessary to know what is the real cause of angina. Thank you very much. Just to reiterate that the pain in abdomen could be because of heartburn, as we have seen in the first situation, could be peptic ulcer, could be gallstones, or could be esophageal spasm. Sometimes easy to distinguish, sometimes very difficult to distinguish. But remember, I will end this session with a story which don't remember if I've told you earlier. A very prominent patient of mine, a rich man, owned a swimming pool. He developed pain in the upper area of the abdomen, lower chest. He thought it is because of gases, flatulence. And flatulence, as we have discussed many times, accompanies the acidity also. And he thought, let me take some antacid, and he slept for 2 hours. After waking up, he realized that the pain was still there. So he thought that the gas is not coming out. Let me do some exercise. He went for a swim, but even after the swim, the pain was still there. Then he rushed to the hospital and the ECG showed a heart attack. So therefore, ladies and gentlemen, this kind of pain in this area, which I had shown you, is a confusing area, lower chest and upper abdomen. If you are not sure, always go and get yourself checked and always rule out a heart problem. Thank you very much. Uh, Needless to say, if you have not subscribed to my channel, please do subscribe. Also, give me a thumbs up to encourage me to give you more and more information like this about the heart. Long live everybody's heart. Thank you very much again.